A first responder must consider the well-being of the victim. We must remember, victims have experienced a traumatic incident. Discussing the incident requires the victim to relive a painful experience, and each case has a different set of circumstances. The first responder should coordinate with the lead investigator to determine whether or not the lead will be responding to the scene, who will conduct the interview, the timing of the interview, and what initial information should be obtained from the victim. You should consider the best location to meet with the victim or reporting party in order to gather basic information. It is recommended that a soft interview room or facility be used, as opposed to a small and confined police interview room. Ultimately, we want the victim to be in a comfortable setting that will promote their willingness to communicate what has happened to them. Observing the victim's body language will tell you a lot about how comfortable they are. Often, the first time you meet with a victim will be at the hospital or clinic, which means you will have limited options for interview locations. You must do your best within the environment to ensure the victim is comfortable. When responding to a medical facility, the first responder should seek out the SANE nurse for introduction to the victim. Constant communication between the first responder and SANE nurse is an important factor in gathering and documenting information. SANE nurses play a pivotal role in collection of physical evidence as well as obtaining pertinent information from the victim. Consider who should be in the room when you talk to the victim. Victims may have family or friends with them who feel it is a good idea to stay with the victim during the interview. It is important to consider how other people in the room could affect the investigation. If you determine it is not a good idea to have others in the room, politely let the victim and others present know why it is important to meet with the victim alone. If available, offer to have a victim advocate sit with the victim during the interview for support. The SANE nurse may also be able to stay in the room for support. It is important to recognize some victims may be intimidated by law enforcement's presence, which makes your demeanor and body language extremely important. When speaking with victims, it is best to sit rather than stand over them. Make eye contact. Lean in when speaking. Avoid crossing your arms or legs. Avoid touching the victim. Consider whether or not you will take notes, record the interview, or both. You may need to refer to your individual law enforcement policies to determine if you should or should not record the interview. If you decide to take notes or record the interview, let the victim know ahead of time and explain why it is important. Tell the victim who you are, why you want to speak to them, and why it is important. Prepare the victim ahead of time by letting them know that the questions you will ask might be difficult to answer for a variety of reasons. Let them know that all of their answers are okay and that you will be patient.